Welcome. Thank you for tuning in to this presentation from the Choices Community of Practice. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. The goal of the Choices Project team is to support these efforts by providing tools, resources, and training opportunities. We hope you enjoy this presentation and find it informative. Thank you for joining us.
Doing nothing to address childhood obesity is not an option. That's true in every state in the United States. We've published a paper a while ago just showing that if current trends continue, most of today's children, actually about 59% we project, will have obesity at age 35. And again, we find these trends happening all over the United States. This is where we're heading, and this model is really at the heart of the Choices microsimulation model of what will happen unless we do something different. With obesity comes excess healthcare cost. I think adults on average incur about an extra $1,000 per year in healthcare cost compared to individuals without obesity. For children, the differences are much smaller, but these just take away resources that we might have to promote health and wellness in other important areas. So that's part of the problem too. What Choices is interested in doing, we're interested in identifying those policies and programs that can improve nutrition and physical activity environments and really provide the best results for dollars invested so that we can improve population health and reduce health disparities at the same time. That's a big goal. And the cost effectiveness analysis is basically to just comparing a couple of different interventions or one policy or intervention with no intervention, and to look at the cost and effect and the relative cost effectiveness of those outcomes. This provides us really a nice framework to really just develop better decision making. It does require that we look carefully for evidence for impact on health. We'll talk about that a bit. The population reach of interventions. Do they reach a few people or a lot of the population? How much it costs to actually implement these activities? Are there any cost offsets? Like if you're effective, can you even save money on different interventions? And then finally, we're very interested in the potential impact, and not just on population health, but on health disparities and health equity. Basically, the model works by projecting where things are headed in the future without any new interventions. I showed you some of that before, our projections for children. We have projections like this for the adult populations too. And then we evaluate our model where we work through, we develop a virtual population, like let's say for your state or city. We begin with a sample based on the census, and then we develop a virtual population of 1 million individuals based on real data, and then project where they're headed in terms of body growth and development, where BMI and obesity is headed in your state or city without any intervention, and the resulting health outcomes of that. And then we take into account the evidence we have for an intervention and project where things would head with that intervention. And then we calculate the outcomes and the cost effectiveness of those results. Now, we do a lot of results, and you'll see some of these in our papers. Again, the inputs. For each of these interventions, we have to figure out how many children or adults are reached by the intervention. we need good evidence of effect of the intervention on health outcomes. And this is often a sticking point. There are lots of things that people would like to do where we don't have any good evidence of effect. But, I mean, there are plenty of interventions out there that with good evidence. And then costing of the interventions is something that typically, even if a study has carefully evaluated the effect of an intervention, often folks haven't really looked at the cost of that strategy. And so what we've been finding is that there are lots of different strategies across sectors that can improve population health. It's kind of remarkable, but actually some strategies are actually cost savings. In the healthcare area, there aren't too many interventions that are cost savings. Some vaccines are one area, like where you see some of this, but some of the strategies we've looked at are actually cost savings as far as we can calculate. Most cost money, but a lot of them we consider a really good value for money interventions. We've also found that if you want some immediate cost savings, it helps to have some focus on adults along with children, just because the healthcare costs are so expensive among adults. Most of the strategies that reach only children require an investment, and I think that makes sense. I mean, most of the things we do with children, like education, require investments. And again, we found that some of the strategies here, a number of them actually are projected to reduce disparities and improve health equity.
Thank you for tuning in to our presentation. You can learn more about the Choices Project, our research, and the community of practice by visiting our website at choicesproject.org.